right, hello, health heads. Welcome and thank you for checking into this bonus dose of the Healthcare Uprising. I'm your producer, Jeremy Carr, here with I almost forgot my job, here with your host, Heather Pierce. So what's on our agenda for today, Heather?
So this is a kind of an interesting long story about complex regional pain syndrome, otherwise known as CRPS, with Christine Weiss. So hers affecting her arm and her hand specifically, and we'll let you listen to the episode to get all the rest of the details. And this one might also piss you off a little bit when it comes down to the kind of the healthcare system. A lot of problems.
I was going to say it's a long one because it's almost 2 episodes. One about her pain syndrome and the other about how broken the healthcare system is.
Yeah, it's failed her over and over again. So watch us get real angry.
Yeah. So without further ado, here's our conversation with Christine Weiss about CRPD?
CRPS.
CRPS.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Christine Weiss, who is here to share her story about complex regional pain syndrome. I will let her tell the story, but Christine, thanks for coming on the show. We're so happy you're here.
Thank you so much. I'm glad to be here.
Yes, we are going to hear the story. And interestingly, the other day, and my husband was actually the last Human Stories episode. We were at his ortho doc and his trauma ortho doc, and he said CRPS during the visit. And I thought of you. I was like, oh, we're bringing Christine on Saturday, who has CRPS, otherwise known as complex regional pain syndrome. So that's we're in the pain.
I have not heard that anagram on the podcast yet.
Well, we are. I know we didn't say it when we did the episode with my husband, but it was weird. I heard it. And so anyway, let me not go too far down that path. Christine, tell us your story. Tell us what happened, why you have CRPS, kind of what led to that, and also that you used to be a nurse. So you've worked in the healthcare space. So that's going to be a very interesting perspective as well.
Yes. Yes. Yeah. Okay. So the day I got injured, it was February 5th, 2022, and had a puppy. The puppy and the older dog were just arguing, and I just slid my hand to bring the puppy back, and the older girl barked, just to get away, and her tooth went right into my hand. And so that was one of the first photos that I had sent you. So her tooth went right in between my 2 knuckles, and hit a nerve bundle. And so instantly, it hurt, obviously. Luckily, my husband is also an RN with a background in ER and trauma. So, we cleaned it up, and we're also in healthcare, so we're not going to go seek treatment either,
You're like, we'll take care of it.
Yeah, I can still move it. The only thing that was weird is it hurt so bad. Like this part of my hand, the whole outside, it hurt. It hurt like I broke it. And up until that point, I had broken a foot and I broke my wrist. But it felt like it was broken, but her mouth didn't go around my hand. So there was no way that was possible. But anyways, so 6 hours later, we had it all wrapped up, and I told my husband, I'm like, you have got to take this off. It felt like what people described as compartment syndrome. It was really painful. And I said, take this off.
That was an issue, potential issue with my husband's accident was compartment syndrome. So,
yeah.
And being a trained nurse, did you seriously suspect that at that point, or
no, not at all?
Okay.
Because there wasn't any bruise. Well, I guess from the pictures it looks like there was a little bit of bruising where the tooth went in, but there wasn't anything over here. It was just swollen. So I just had him take it off, and we cleaned it up a little bit more, and I was like, all right, if by morning it's still bad, then I'll go to urgent care. So I went to urgent care, and he was like, did you get bit by a cat? And I'm like, no, it was a dog. Went for x-rays, no broken bones. And he's like, it really looks like you already are infected. I want to send you to the ER. He goes, but let's just start you on antibiotics. He's like, if it gets worse, then go. So about 24 hours later, Oh, I had went home and I like marked my arm. So I think I sent a photo of that.
Oh, that when I saw the dashes on
Yeah.
your kind of above your wrist, I was wondering what that was.
So
Okay,
the
Yeah.
swelling, right?
Yeah. So I
gotcha.
marked my arm so we could like kind of monitor how swollen it was getting, but it
You
didn't
are a
matter.
nurse.
Yeah.
Like
No, but
nobody else would do that.
my background also is labor and delivery, and then I
Oh,
specialized in bereavement, but I could talk about that
okay.
later. So anything with blood, even the kids, they'd always go to him. My parents, anybody, they go to my husband. So yeah, I knew to market, and so I was like, okay, like it was 48 hours later, and I'm like, this arm it looked like a wax arm. It was swollen past my elbow. I now
Oh,
didn't have any feeling all the way up into my elbow. It was
Wow.
really, really strange. It did, yeah, it looked pretty awful. So I went in
mm.
to the ER, and I also watched the time because I knew what time change of shift was, and so I kind of monitored when I was going to go into both, you know, and so I ended up having surgery just to clean it out about um, I don't know, I think the next day they came in and did that. And there's a story behind that too, but I'll tell the basics and then we can go back if there's
Sure.
time.
Yeah, absolutely. Yeah, this is
Yeah.
good. Just kind of get the
Okay.
overall
All right.
situation.
And so that was February 8th for the surgery. February 19th is when I had my post-op. Um, I also, let me back up. I also they put a PICC line in, and was giving me antibiotics through the PICC
Oh,
line, and I had that for 3 weeks. I eventually got a call from infectious diseases canceling all my appointments because they said I had absolutely zero infection. They couldn't find
really?
any bacterial infection, nothing. There was nothing.
Oh,
And so now, four and a half
So
years
weird.
later, or even maybe like 3.5 years ago, or 3.5 years into my journey, my husband and I are like, and the doctor, we were like, well, I bet you it was CRPS right from the beginning. I mean, with the way that it was responding, but who knows, whatever.
mm.
Um, so February 19th, um, I had a follow-up and they started physical therapy right away. So in March, I wrote down my little notes. Hold on. So
And were
March.
you feeling pain and or numbness at that
Oh, okay.
point?
Yeah. So yes, the pain. So let me talk about pain real quick. So I deliver my daughter natural, which my choice, but I wanted to. And I've had a kidney stone. So when you talk about pain, it was painful, but everything I associated is to what it's like to deliver my daughter.
Hmm.
So, um, this was just unrelenting. Like it would just keep coming, and then it would fade a little bit and then it would come back. And I would say that no insult to anybody who has Tourette's, but I would say that I'd get into that mode because I'd be like, oh, fuck, 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 and it would
Yeah.
be
Oh,
anywhere
that's the
because it would just
worst.
be so painful and it didn't make sense. Like it just
Yeah.
didn't make sense because it would be months later. I would still have the same pain, but it'd be random. And
Yeah.
so I
There's a
started physical
lot
therapy in
weird with
March.
that.
What'd you say? I'm sorry.
A lot of that's weird because like the swelling without the infection and the pain from such a small, what seems to be such a small injury, really to begin with,
Yeah.
Yes,
spreading through your whole arm and like killing the nerve in your whole arm. Like I saw
100%.
the picture, your first picture of the initial puncture wound, and
It doesn't look
I feel like I've had wounds like that.
typical.
You know
Yes.
what I mean? It doesn't look that bad.
Right. People have had paper cuts that have looked like that. It really wasn't a
Yeah.
big deal.
Yeah,
Um,
it's crazy. And
That
did they when they did the surgery to clean it out, was there a diagnosis at that point?
no, no,
They were
there
just
was
like,
never,
we are
it
still
was
really not sure what's going on.
dog bite injury. And funny enough,
Just
when I messaged
wow.
you, um, I, um, I ended up looking through more of my paperwork because I have notes. It's
Hmm.
interesting when I went back and looked at my journal because you can see the journey I've been on and where I'm at today compared to,
Hmm.
like I was very grieving very, very hard, and
Mm.
but I came across like medical documents where I was like, hey, honey, look, they put in here that I was referred for infection. They put here that I was referred to pain for this. I'm like, none of this was accurate even back at the beginning. They would have the wrong
Oh,
information. So
wow.
I was referred even for, when I finally got referred for the pain doctor, it was a year later. So I'll get to that here in a
what?
second.
Okay. But you
but
were in
A
pain this
year?
entire time.
the entire time. And
Oh my
I
goodness.
chose not to have any pain medicine. So
Okay. That was your choice. Was it
that was my
offered to you though?
choice. I'm sorry.
Was it offered though as
No, actually, it was never offered. I think one
really?
time I was offered Tylenol. I eventually said, well, you know what? It's okay. I smoke weed. So I'm going to smoke weed.
You're like, I'm fine.
Yeah,
I
I'm going to
mean,
medicate
Nothing
when I
incredible you
need
can't
honestly,
to.
handle.
that was
Yeah,
part of my husband's protocol too. So,
yeah, it was terrible. I'm okay right now because I have a pain patch on. So I'm at a point where I'm more stable and can not nap 5 hours a day anymore. So
mm,
so I'm much
the pain
different.
pills knock you out. Yeah.
Yes. Well, and that was just it.
And the
I
weed
didn't
can
want to
too if you're
take
using it
the
that way.
pain pills because I knew um, I have seen what it's done in the medical field. And so
Hmm.
I knew that I've seen people get on it, then you're in bed, then you're sleeping, you're not moving your body.
Yeah.
Okay, it maybe take your pain away, but then you have so many other things that will happen. Then you have constipation, then you have,
Hmm.
just then you have an intolerance eventually. And I just knew for me, I didn't want to go down that route. And
Hmm.
so there were days that I would have what they call a flare up. And those are the days when the pain just flares up.
Yeah.
It just is worse than normal, and it can be activated because it's part of your sympathetic nervous system. So the
Hmm.
complex regional pain syndrome affects your nervous system,
Gotcha.
and
Okay.
but we didn't find this out until much later. It was
Okay.
um, a month in, I'm doing physical therapy. And I can't remember if it was March or April, but my physical therapist, who is a hand person, he said, "Have you ever heard of CRPS?" And I was like, one person in my life. It was a firefighter. I had worked with his wife, and he had a shoulder injury. When I met him, he was 12 years into his injury. He had
Wow.
already been using a cane permanently, sometimes a walker, sometimes a
Mm.
wheelchair. He had been through detox 3 times. He was on, he had gone through ketamine IV at that time.
Hmm.
I mean, it's been really terrible. It's been a very terrible journey for him. And so
Wow.
that was my only person that I knew. And I just remember in my mind thinking, I'm not, that's not going to be me. And I just like, if that is, I know where my life's going to lead. So I'm just not going to look at it. I'm not going to listen. I'm going to keep moving forward. Well, by May, I had called the doctor because I was supposed to go in for a follow-up. We were supposed to have a nerve conduction test to see, if there were nerve damage because it just didn't make sense. Sometimes it was never okay, but like sometimes I would do physical therapy and I would have the strength depending on the time of the morning. It was like in the morning after after I've rested, then I was able to like never open a jar, but I was able to do more, maybe
Hmm.
hold on to something, but never with this part of my hand. I could usually use this part of my hand. It was really weird.
So
Um,
you weren't really your hand essentially that injured arm hand was not really functional at this
yeah,
point. I mean you're going through PT, but like you weren't able to like hold things. You couldn't
right.
maybe, I don't know, hold a pen or scissors or something like that.
Well, I'm left-handed, so that's what
Oh,
and that's what they kept saying is like, oh, well, lucky you're left-handed. I'm like, sure, but I'm a labor and delivery nurse,
yeah.
and right
Use
now
both hands.
yeah, right now I catch babies, and so I can't be like, hey, here's your baby. Oops,
Oh,
like let me
right.
hold a leg. Oops, like
Yeah.
my arm just wasn't consistent, and so the doctor would tell me you can't go back to work unless you can promise me you won't use your arm, and I was like, I don't
Uh,
know in what capacity I can do that in my job. Like,
uh-huh.
can you guarantee you won't use your left arm? Nope, I can't
No.
guarantee that at all. So I was kind of
Were
left.
you on disability at that point? Like
No,
out
I
of
was
work?
not. No.
Okay.
I was getting short-term disability, but that
You
all
were.
changed. That all changed
Oh,
in May. So, and
okay.
yeah.
Okay.
So, oh yeah, you just triggered me a
And
thought, and then I just forgot about. I'll
and
come
thank
back to
God
it.
for short-term disability, by the way, that people get through their employers because if that's can be somebody's saving grace financially, right? Like during a time where you're not working and bringing income in.
Yes, yes, it
Yeah.
is. Until you met the guy who took care of my case.
Oh, okay.
So, yeah.
Oh, jeez.
So,
All right.
yeah. Um, so, I forgot where I was. Uh, in May, I had called the doctor and I was like, hey, we had talked about If this continues, we were going to do a nerve conduction test. If the nerve conduction test comes back, either says, yes, I have nerve damage, or no, is the treatment still the same? Are we still doing physical therapy? Because it just doesn't make sense how my arm, I'll wake up and it looks semi-normal and there's no swelling and I can move it. And by the time I'm done with physical therapy, I'm in so much pain, I can no longer use my arm. I have to take a nap. Like, I don't know how to recover from this. The weird thing is during that time, it was starting to travel, and I didn't really understand it at the time, but I would have these periods where it would affect my hip. So only my left hip. And it would take me completely to the floor, and I would just be crying in agony because I couldn't move. I couldn't stretch it. I couldn't do anything. I couldn't figure out why it was happening. And that comes into play when I go and see the pain doctor. So we couldn't figure out, like, it was more my husband and I just kept, jotting down little notes, like, this is so weird. Like, why is this happening?
Yeah. So the pain traveled from your arm to your hip.
Yep.
That's like, you would think it would be in like your shoulder or somewhere else.
Well, yeah, it's so disconnected from the injury.
Yeah.
It would travel. And what would happen is I would feel like this ache, like right above my hip area. I would feel this pain almost like, and then it would lead into, you would understand, Heather, like period cramps, like it would lead into that spot. And I had really bad endometriosis before. And so it would almost feel like that. But then I couldn't move my hip. Like, I would be on the floor,
like locked,
crying out,
almost like locked in place.
Yeah. I couldn't move. I'd be stuck on the ground. I didn't know how to get up. Like, I couldn't move my body to get up, and it was scary. I'm sorry.
This didn't just injure your hand then. This like affected your whole nervous system, like as a whole system.
And that's what it does. It affects your whole entire nervous system. It affects your fight or flight. And so when I finally saw the doctor that ended up helping me, like truly helping me in January of 2025, we started on the pain patch, and a lot of other things started to like finally work. One, I had a doctor listen to me. One, I could finally move. That's not what I was going to say, though. You left me into a question. You asked me
look at us.
something.
We're derailing you left and right with all of our questions.
No, because
you were at when it hit your hip. That's where you were at.
Yeah. Okay. Yeah. Well, so I'll just jump ahead just real quick. So when I finally got to the pain doctor, when I first saw the first one, it was almost 1 year exactly after the injury. And they kept talking about chronic back pain. And I'm like, I don't have chronic back pain. That's not why I'm here. I'm here because I have CRPS, because by now, this is what they're telling me, because by now I've already had the nerve conduction test and I've seen a neurologist. Okay. So, but they wanted to give me a lumbar puncture in my back to handle this back pain. And I'm like, but I'm not having chronic back pain. I'm having this other issue. In May of that year of 2023, in that clinic, a PA was in there and he was saying, well, sometimes when I'm doing surgery and I put my head like this, sometimes, I'll get that pain. So everybody kept like reverting it back to like, maybe it's sciatica. And I'm like, it's not sciatica. Oh, I remember what I was going to say. What would happen is I would get like a little pinch or a little pain, and then all of a sudden my hand would start to swell.
Oh,
it would be connected. So that's how all of a sudden I'd be like, oh no, okay, let's see what's happening. And then my arm would start to swell. So it'd be like wherever I start to have a weird twinge, now because it does travel all the way into my foot, I'll get like a burning sensation in my arch. And I'll be like, okay, well, what's going on? I'm happy. I'm in a great mood. Well, that can activate it. It's your fight or flight. My body's going, hey, we need to respond somehow. Is the wind blowing today? I don't know. Like anything that would activate that nerve, is going to activate it. However, during sex, activates it. That's miserable. So it's either you work through the pain and enjoy it, or you don't. It sounds kind of sadistic, or whatever that word is.
Some people like that.
Yeah, I mean, hey, I guess I do.
That's
a little
crazy
bit now.
though. Like
it's a instant reaction the other way.
So bizarre.
Yeah.
Okay.
And
Wow. So that's happening.
definitely every single person responds to this differently. 100%.
Yeah.
There's not one of us that will respond the same way. This is my journey. Not one of us, we don't have the same type of injury. Sometimes there's no nerve damage at all that's known. And sometimes there is. Sometimes it's from surgery. Sometimes it just can activate. They don't know why it happens.
Mhm.
Right before I came on today, I was listening to a podcast, and it was not podcast, sorry. It was a conference that rsds.org. I'm going to get the name wrong. It's somewhere in here in my notes. Give me 1 second. It's nope.
We'll find it.
Of course, I'm not
RSDS.
getting.
I'll look it up while you're.
Yes. So rsds.org, and it talks, and it's basically what CRPS used to be called for 40 years. But before that, it was called Casalgia. Oh my gosh, I'm never going to say that one right either.
These words, I tell you, supporting the
Yes.
CRPS community is what it says
Yes.
here. Okay.
So they just had a conference, and I loved it because in one of the segments, there were two doctors on there that they were saying exactly what my husband and I have been saying this whole time is every single one of us show up differently. Every
Mhm.
single one of us respond to pain differently. Every one of us are brought up differently. So how, and who's ever taking care of us, they need to take time, to listen to the story, how it's happening, how we respond to pain, what kind of pain we have. And as a side note, as a labor and delivery nurse, I would get a patient that would come in for triage thinking that they were in labor. Let's say they've never been in labor before, right? I would want to know what their worst amount of pain is because sometimes they're showing up and they're scared. Your pain is going to be intensified if you're scared. So let's have a conversation about what your worst pain is. Tell me what those period cramps are. Tell me how pain is associated. If you've never had period cramps before, then these pains you're feeling from beginning labor could feel awful. But if you've had horrible period cramps and these you're telling me are like, oh, they're bad, but not as bad, then we're talking about it, right? You're not in labor. When those pain is worse than, I'm not saying you're not in labor. I don't want that to ever,
Right.
but if somebody's never had period cramps, they've never been in labor, you need to find out what their pain level is. So
Yeah.
sometimes I'll look at that when I hear about people's stories, with CRPS. And it's like, well, if you've never heard about pain or you've never talked about it or you've never had worse pain, then this is your worst pain ever.
Yep.
I don't know
Pain
if that helps.
tolerance is different for everybody.
Yeah.
100%. 100%.
Yeah.
So anyway, so yeah, where it became a disaster at the beginning is they say that you have a better chance of recovering if you do early intervention. Well, in May, when I called my doctor's office, I said, hey, before I come into my next appointment, we talked about getting the nerve conduction test. Would you like to order that before I come in so we can have results before my next appointment? I said, because I just went and lifted a box of macaroni and cheese and it fell out of my hand. I
Oh,
just dropped a phone. Like I kept dropping things. There was no correlation to or not, that's not the right word, but I couldn't tell where like the table was. Like I couldn't feel where things were. It was like noticeably getting worse. And so like, sure. So then they sent me a referral. It was out of network. So
of
I
course.
called back, asked for another referral. That took 2 or 3 weeks. It came back, wrong place. It was the same place that they had sent me
my
2,
gosh.
3 weeks earlier.
Man.
So then they called me. We went through it again. By this point, I was like, I've had so many issues that now let's go ahead and do email. So now we're on to the third time. Now this place was also out of network. So new place out of network. So I'm like, I don't know what's going on. Somebody needs to now send in my paperwork to my work and let them know that I'm still not able to return after 4 months. Because now we're into July,
June,
August.
July. Oh, okay.
By now, I'm not getting paid short-term disability.
Oh, right. Because that's over because it's short term.
The short-term disability person would not pay me because he was saying that I didn't have the proper medical documentation. Well, and he's right, because in May is when my appointment now got canceled because I wasn't getting my nerve conduction test. So if I don't have my nerve conduction test done, she didn't want to see me in the office because she wanted to go over those results. There was no reason for it. So it didn't matter how many times I called and said, hey, you guys, she's not seeing me. I need some documentation. So then I was like, will you take documentation from my primary care doctor? My primary care doctor wouldn't fill out any information because she never actually saw me for my dog bite. So
Oh
she
my
would not fill
gosh.
out my paperwork. And so when I would
How
call and ask for
frustrating.
help, they would tell me, well, you're a nurse, you understand. When I would call about the appointments being delayed, they would say, well, you know how things happen. You know why they keep getting delayed. You're a nurse, you work in healthcare. True.
Uh,
So we're just going
So,
to accept the fact that everything's broken and run with it,
and just be like,
yes,
screw
but
it.
not do anything to fix any of
Suck
it.
it up, Buttercup, right?
100%.
We don't
This is why
100%.
we have this podcast.
we don't care
Yes.
how this is affecting and
Oh
disrupting
my
your
God.
life.
Yeah.
Just be okay with
I
it.
had tried to keep in contact
I'm
with
angry for you.
I'm so
my
mad right now.
employer.
Yeah.
I'm so mad right now.
Me
Yeah.
too.
I tried to keep updated with my employer. I let my manager know, also a nurse, right, in
Uh-huh.
healthcare. I tried to keep in contact with people, letting them know by this time I'm grieving, I'm upset, I don't have
Sure.
feeling, I don't know what life is like. This
Yeah.
isn't what my plan is, you know.
Ugh, that sucks.
Everybody, of course, feedback is get a second opinion, or it's you're a great nurse, good luck. I finally in August, I was like, I don't have any more documentation I can give you. I only can give you what they have given me. Short-term disability wanted me to submit, you know, my documentation, and I told them, I said, so I'm going to submit my physical that I had in July. And you're going to tell me that I'm denied because it has nothing to do with my dog bite. But you still want me to get the paperwork and submit it to you. Yes. So I would. And then they would deny me. And so it was just this whole thing. And so then I would tell them, well, I'm trying to get into my doctor's office, my surgeon. They want me to have this test done. You're telling me that you won't pay me for short-term disability because you want medical documentation, but I don't know how I can get an appointment. I've gone in there. They keep telling me the same thing. I just don't know what to tell you. I have emails to prove it. So
Mm-hmm.
moving forward, I called the vice president of human resources. I
Mm-hmm.
called insurance. I called disability. I called, finally got a hold of somebody in, I believe, risk management or somebody who are supposed to be on your side, and she was not nice to me. She asked me why it was taking me so long to get an appointment, and I said, look, this is my story. So this was in August, and I finally got an advocate from the insurance company, or she got me an advocate from somewhere.
Okay.
That woman, it took her 10 days to get a hold of somebody at the doctor's office. 10 days.
Holy crap.
Yep. Yeah.
Okay.
So 10 days.
So,
Keeps getting worse.
yeah.
So I finally got in October to see the neurologist. And when I
Good
called
grief.
the lady back at my hospital and said, hey, I got an appointment, she's like, why did that take so long?
Yeah, exactly. Why did that take
And
so
this is why people lose their shit when it comes to the healthcare system. This is why we're angry and pissed off because of stuff like this, and you're suffering.
It's
It
also
gets
why
better.
it's
It's
also
better.
why life expectancy in America is way below Europe.
It's
Way
ridiculous.
below. Like we live like 12 years less on
Okay,
average.
we came
This
here.
is why.
Listen,
This is why.
we came here to talk about CRPS, but now I'm just really angry.
Sorry.
Like more than I was.
Different conversation, yes.
Now,
I know.
okay.
I told my husband, I was like, you know what? This has so many layers that like I listened to
So many.
your podcast with the nurse, and I was like, oh my gosh, I want to talk so bad. Let's have a round table. Like, let's talk.
Let's have a round table.
With Nurse Meg.
Let's do it.
Yes. Yes.
Sure.
Oh my gosh, I would love it. I'd love to be a part of it.
On like Donkey Kong. All right, continue your story before I
Okay.
completely derail us into a entirely different
Oh, I'm so
conversation
mad
about
right now.
why the healthcare system is completely messed up and broken.
It gets better. So
Okay.
So
Oh, no.
I get in with the neurologist, and my husband comes with me, and I just want to tell you the players. So it's me and my husband, the neurologist, and he has a resident in there.
Okay.
So the minute he starts testing my arm, it changes colors. It starts showing all the signs. I'm telling him, I'm like, yes, I know we've been waiting a long time for this test to be done, but these are the problems that I've been having. It was swelling up. I've lost feeling, hot, cold, temperature changes. It's just all over the place. It doesn't make sense. The pain is unbearable, and so he's like, yeah, well, you sure are responding, basically was his response. You're responding, it really does look like you have CRPS. He goes, but I can't get down and test the nerves where you were actually injured because the nerves are too small. I'm like, okay, fair enough. I understand. So that was the beginning of October. It took me 3 weeks before I finally got the report, and all it said on there was negative nerve test or whatever it was. It was negative. Nothing about CRPS. Nothing about couldn't test the excuse me, test the small nerves in her hand. Nothing. I email him directly and I'm like, hey, why is this? I'm getting ready to go see, go in to finally see the surgeon since April. I'm like, this is ridiculous. And I said, and it's so much worse than what it was before. And you didn't even write anything. He goes, well, what you want is an office visit. He goes, and so you need to come in for that. He goes, I only answered their question and I answered it. It was negative for your nerve damage. And I was like, but you couldn't test my hand, like where I was actually injured. I'm so confused by this. So my cousin is an ER doctor. And so about a year and a half ago, I said, will you please send me the latest research? And I need to talk to you about this. And she said, I know it sounds awful, but in all reality, he really was just answering the question. And I said, but why wouldn't he at least put in there that he couldn't test the actual nerve damage site? Like, why couldn't he at least put that in there? She's like, I can't answer to it. So anyways, moving forward. So in November, I see him and we do a really fast $50 office visit, for him to just write up. He just says, tell me the story again, writes basically what I say and says, you know what, 2 years, you got about 2 years. He goes, you need to figure out, maybe do some yoga or meditation. Cool. Awesome.
Cool. Okay.
Not what I have read about it, not what I know about it, not 2 years. So
oh my gosh.
I also saw the PA at that time. And let me tell you, in October, I also I finally got a hold of the office manager at the surgeon's office. And we had a discussion about this. And she says, I am so sorry, but you fell through the cracks.
You think?
Yeah, I sure did. I said, how about you see if the surgeon can be there at my next appointment? I think he needs to be there. And at this point, all I wanted to do was have a conversation. He didn't cause my CRPS. At that time, I already knew you didn't cause it. If this is what you guys are diagnosing me with, you didn't cause it. But I just want to have a conversation about how you are handling stuff in your office, because I worked at a doctor's office before I became a nurse. So I know how it works. A phone call comes in, a patient has a question. Mine was, hey, they sent me to the wrong place. That message goes to the MA. They take down the message. Then it goes to the PA. At some point, that surgeon has to see that record. So this would have come in again when it was like, hey, we sent to the wrong place, patient called again. Hey, patient called again wondering where this is. Hey, patient called again saying that we were sent her to the wrong place. Hey, patient inquired again that she still hasn't heard from us. Patient called again. Like, they should have this by now, this whole documentation right on the front page, if they took notes like I did when I worked at the doctor's office. So, I mean, if, right? So, I mean, it had to have seen, but the doctor had to see it at least 3 times. 3 times. That didn't red flag you that there was a problem, So the doctor decided not to show up to my appointment, and I got a letter of a letter right here. This is what I was supposed to give. You can't really see it, I guess, but this letter from my PA apologizing that I did my due diligence. But hopefully this will work to help pay me for my short-term disability that they owe me. And also help now, because now I have an interview with the assistant manager of the disability management department, because they want to figure out how I can come back to work.
Oh, with your employer?
Yeah, my employer.
Okay.
And so I had asked him, I said, so all these letters that I'm getting that are denying me for long-term disability or short-term disability, and this one right here, the latest one that says that this person that's non-medical says that it's taking me a long time to recover from just a dog bite. And that's an exact word. Taking a long time to recover from just a dog bite.
Just a dog bite.
Yeah. I said, they're making the decision on whether or not I get approval. So it's based on what they're reporting off. But now, if you are looking at medical records, yeah, you could clearly see that. But then why did you have your care person call me, your care manager, care coordinator call me, and hear this whole story and hear how I'm having so much trouble and be like, sorry, we can't help you? you know? So I asked the disability people, I go, how many of these letters or how many of these phone calls can you hear, you know, that I've had with these people? Like I've been calling, I've been leaving messages about what's been going on. I mean,
Yeah.
how do you expect people to live or survive on no income? You literally shut
Right.
down everything, nothing.
That's
I'm like, I don't
insane.
understand this. And I work for this hospital. That's a big hospital. I don't understand. And
Mm.
so the the disability manager asked me to send him all the documentation. And I think it was 2 weeks later, I heard from them and they said, we'll go ahead and approve you for your short-term disability, but you're going to have to resubmit all your claims for long-term disability. So in November, I did receive a check for the backup pay from like,
Okay.
like May through August that I would have been paid. They did pay me.
Okay. Well,
Now
that's
they,
good.
yeah. So now they
Way
said in order
late.
to
Yeah.
backdate it to August, I would have to submit medical records. And I said, well, what medical records?
Yeah.
The same medical records that you just approved me for as of right now is going to be the same medical records that I'm going to be giving you
For the long term.
because, yeah, because
Yeah.
It's the same thing.
I've now been referred to pain management. So at
Okay.
this point in November, I'm referred to pain management. Now,
Okay.
guess what happened?
Oh God.
The
I
first
don't know if I want
referral,
to. I don't
the
know
first
if I want to
referral,
know.
the first
Out of
referral
network?
out of network.
Of course.
So,
Because of course it was out of network.
yes. So, Um, and
Mm.
and so that took, I immediately called the advocate and I said, look, it's happening again. So by the time they figured it out, I got a phone call saying she's no longer out of network when our insurance changed over the effective the first of the year.
Oh, geez.
So I went and saw the doctor in February. So anyway, so I saw that doctor in February. This is 2023, 1 year later. By then, like I said, it had spread through my hip. And now I'm finding this stuff about chronic back pain. I'm asking about it. Why are we doing this? It only happens when I flare up into my hip. Well, we're going to go ahead and just do this lumbar puncture anyways. Okay, fine. You're the professionals. By the way, here's a packet on CRPS.
So they literally want to give you a surgery for something that you don't have a problem with.
They just wanted to do a lumbar puncture. So
That's
it's
not really a surgery. Yeah.
well, yeah, no, just medicine, right? Like,
Yeah.
Right.
yeah, basically.
Okay.
Well, I mean, it's still an invasive thing, right?
Yeah.
Like,
Yeah,
and it's
yeah.
not treating your symptoms. Like, it's not even
100%.
what's wrong with you.
Mm,
Right. Right.
Interesting.
That's insane.
Yep. And so at that time, um, the next thing that was, my husband wrote it down, so I would say it the right way. A stellate
Stellate
ganglion block.
Gagnian block or something.
Good. Yes,
Look at
that's it.
me.
I've
Yay.
heard that before. When did we talk about that?
I actually think that came up
Came up
in the
somewhere.
ketamine episodes.
There you go.
Yeah,
Okay.
Jessica Tracy, I think.
I believe so. Yes.
Yes.
Okay.
So at the time, we were told that if I had a negative response to this, that I would not be a candidate for a spinal cord stimulator, which is a
Okay.
whole other topic.
Wow. Okay.
None of this ever made sense to me. I didn't understand, again, labor nurse, but I never understood why we keep injecting things into our, why we're doing this to the nervous system, like, especially with how quickly I responded to it. Within, I don't know, 15 minutes, I was feeling like hot. And then I was starting to get swollen. By that night, I was completely flared out. I was awful. It was the
After the
worst
lumbar
time of my
thing?
life. Huh?
After that lumbar.
After I got the stellate ganglion
Oh,
block.
that one. Okay, got it.
Yeah, so
Sorry.
that was a month after. It was a month
Gotcha.
after I got the lumbar puncture. By the way, it didn't help. I still would flare up and have the same exact thing with
So
my hip.
it was pointless, just like you
Yeah.
kind of
Just
Yeah.
kind of like you knew it would be.
anticipated.
Just like we all knew it would be.
Right.
Yes, right.
I'm not a doctor and I don't play
Right.
one on TV, but
Oh my goodness.
So the whoever his assistant is, I don't know who they have call. He called to check on me the next day. Hey, how are you doing? I'm doing really terrible. It was awful. I had this symptom, right? Nothing. Nobody ever called back. Nobody ever said it was normal. And by the way, it was an ER trip worthy. It was ER trip worthy. I should have
Really?
gone to the ER. I was in so much fucking pain
oh
that
God.
I should have went to the ER. I didn't though, because I also grew up in the world of nursing where
Yeah.
pain is so judgmental. People judge pain. They
Yep.
judge it so badly, and I didn't want them to do that to me.
Mm.
So
You sucked it up.
I did what we teach our women that go through natural labor.
Also
You know,
that.
I did what I had to do, you know? I
Yeah.
mean,
Wow. How long did
so
it last?
oh gosh. So it was a good altogether. I wasn't in that severe pain for more than 12 hours, but like the spiral after, like just the
Mm.
tired, I was exhausted. Like I felt like I got
Yeah.
hit by a truck. I was so tired. Just my body worked so hard. It's
Hmm.
crazy. And that's one of the symptoms too, is now I'll jump backwards at the beginning. Um, Sweat so bad, it feels like you were in a pool or like you just got out of the shower and didn't dry off. I would wake up like that, like
From the pain?
from must have been, it was it was probably my nervous system. You know, you think about the
Okay.
fight or flight, so the cooling off period, right?
Uh-huh.
So you know, from all the pain, working so hard, doing all that stuff, and then, you know, my body relaxing, cooling off, it would sweat. I'm wondering. That's the only
Oh,
thing that makes sense. I
okay.
have talked to a lot of other people with CRPS, and those are very early symptoms of it to
Mm.
still have sweat. And in case anybody asks, I am on hormone therapy. It had nothing to do with my hormones; those were all in check. So
Yep.
it was totally related to that. Um, Loss of hair on that limb, color change. Oh gosh, what were some of the other things? So many weird symptoms that happened towards the beginning.
Hmm.
But anyways, I ended up getting a total of three of those blocks because, of course, the new doctor that was in the office is telling me that this is the best treatment for them. And I'm like, okay, but I've had these symptoms and now it's permanently through my elbow, permanent. Like I have no feeling through my elbow. And
So you
and
had no
so
use. This is like November, whatever, December, whenever these,
this would be
maybe
like
even,
April or May of 2023.
oh, we're all, okay. So we're like over a year out. You still have no use, pain, numb, right?
Yep.
Like you can't hold anything.
Yep. I
Gotcha.
use,
Okay.
I've adapted to where I'll use like these fingers when I can. So I'll grip.
Okay.
Everything is gripping with these fingers.
Oh,
So like
Mm.
eventually, okay, so this is the part where I hope I'm not going to cry. Okay, so May of 2023, I thought that I had met like the greatest doctor. I thought he was a total advocate. He came in and he was like, I know you were supposed to see the other doctor. She's no longer with us. And I was like, well, that's okay, anyways, because I want to address why she kept referring to chronic back pain. This is what's been going on. Again, they kept referring back to that pain being related to a pinched nerve, you know, like the sciatica, not
hmm.
the same thing.
Right.
We talked about he said, well, he goes, unfortunately, he goes, you've read through the packet. And I said, yes. I said, I've also looked through a few of the support groups. And he's like, don't listen to those. Don't look at those. And
Like
I said,
CRPS support
mm-hmm.
groups. Okay.
Yep. And I said, okay, well, let's step back a minute. I said, first of all, I said, I'm an intelligent person. I said, I've been a nurse for a long time. I said, I also had to study and do research. You know, I said, so when I look at them, and this isn't meaning any criticism or judgment, but I would almost like triage, you know, the groups. Like I would look at what people would say, and I started to notice what year they were diagnosed, you know, what their symptoms were, what comorbidities they had. So, what else did they have that was going on? Was it after they took all these different medications? How many times have they gotten the same block that I did? Where has it spread to their body? You know, like I started to see just different things and I started to realize, well, one, thank goodness I'm diagnosed now and not 20 years ago. You know, I started to meet people that were, you know, different parts of their bodies, you know, were affected by it and kind of what they've gone through with treatment, you know. So that's what I started to notice. And so when he's telling me not to look at it, I'm like, well, just the opposite. I'm learning from them.
Hmm.
And the group that I was in at the time was a nurse-led group. And
Oh,
so, like, you know, she recommended a book that was um, Why Are My Nerves So Sensitive? So it's written, you know, for CRPS. But when I started
mhm.
to realize it, I noticed anybody should read this book. Any person, any human should read it. It's all about calming your body, calming your nerves.
Put that on your reading list, Jeremy.
That absolutely sounds like something I'm going to read now.
Yep.
Yeah.
Yeah. So I mean, it was just, that's what I was getting at. But it kind of, I don't know, it bothered me that he was telling me not to listen to him, because here he's handing me, going over this packet with me. Now he's telling me to file disability. And I just remember looking and I'm going, file disability. I'm like, what are you talking? Like, I just want to know when I can go back to work. He's like, well, he goes, you're going to end up in a wheelchair. And
Oh
I'm
my
like,
God.
What?
I'm going to what? Like, he goes, well, eventually, because of the nerve, and because of the way this works on your body, he goes, eventually your muscles will atrophy if you don't move them. And eventually you're going to end up in a wheelchair. You're going to need to file for disability. And I was like, okay, so, all right. Can
my
I,
God.
if I can't
Okay.
use my arm, so, and this is where I was, where it hurts to move it and it hurts to leave it still. So if I leave my arm and elevate it, then it hurts in my elbow. If I don't know, any other movement, if I put a compression sock on it, that hurts. Like any of the things that they kept saying were recommended, it's like, it's not working. It hurts worse. Like I can't do what you're saying to do. But if you're telling me I'm never going to get feeling back in my arm, then is there like a bionic arm? I just want to know how I can do my normal things again. If I can't do nursing,
Yeah.
what am I going to do? And I'm a specialty nurse. I'm not just like, people will say, oh, well, you're a nurse, you can go. No. I don't know medications on other floors. I don't know that stuff. I don't. And let's be real. I'm in pain. I'm on medication.
Yeah.
I'm on weed. I'm
Yep.
on stuff to help me get through each and every day, So anyways,
Still to this day. Well, obviously you did say you were on a pain patch.
I
so
am
we'll
on a
have
pain
to-
patch now. So
Yeah.
anyways, so this doctor, he's telling me that he's going to be there for me. I go, okay, so what if, I said, there's a lot of talk about a spinal cord stimulator. I said, I don't really want one. I said, all the research I'm doing, it says you're going to have to put it in my neck. Whether or not that's true, I don't know, but I'm just not interested. It doesn't sound like it's going to help me. Like, I'm not a fan. I don't want to get it. It sounds
Is
like
that
it's the
something
worst.
that is like put like permanent?
Yes. Yes.
Kind of like a pacemaker for your nervous system.
Yes.
My nephew had seizures, epilepsy, and they had it was like a vagus nerve stimulator or
Yes.
something, and it would like stop. And so I was thinking, because he had it like actually, like it was in him, right?
Yeah. Yeah.
Yeah, permanent. And I can't think of the right word, but
Yes,
not
it's in there.
installed.
A
Sounds
lot
like
of,
a
I mean,
robot.
Implanted.
Implanted. Thank you.
yes.
That's the word.
Again, with the syndrome, some people it worked on and some didn't. I would see that too. I'm like, okay, so let's say you're somebody that had chronic back pain, but your CRPS was in your foot. Now you're in bed. Now you are worse, maybe. Then you get the spinal cord stimulator, your back is better, then you're up moving around, and then all of a sudden your foot's feeling better. I don't know. I don't want to be a conspiracy theorist, or I don't want to put any ideas into anybody. It just, when I'm looking at it just, spinal cord stimulator was not going to be for me. And a lot of people that I knew that had it would tell me no also. And so the current doctor that I'm seeing now also doesn't agree, unless they've gone over everything else and talked about everything else. Like I said, every journey is different. So anyway, so this doctor, he's telling me that I'm going to be in a wheelchair. I end up agreeing to the next block. Same reaction. It was awful. By the third block, I get a phone call and the doctor can no longer see me. They want me to go out and now see a new doctor.
Why? Did they say why?
He said he wasn't on my insurance anymore.
Oh my God, the
So-
damn insurance.
Right. And so my
Jesus.
next appointment with him, he was supposed to help me fill out all my disability paperwork. So now I'm like, okay, well, this really stinks. And so I didn't really want to go see that doctor. And so, because I didn't know him, I'm like, I don't want to just go in and have him do this. I've never met him. I don't feel comfortable. So I made an appointment to go in. It was the PA who's not going to be doing the procedure anyways. So that's really annoying. So again, I didn't meet the doctor who actually did it until the day of. And again, same reaction. So moving forward, that was June of 2023, I think, was the last time.
Okay.
I ended up getting a second opinion sometime between 2023 and 2024. And in that time, I also fired the original pain clinic because I went in there to talk to them again. I'm like, this is ridiculous. I don't know what to do. I'm like, can we talk about ketamine? And at that time, I mean, I get conflicting stories, but I did call several places and they told me I needed a referral. My doctor did refer me, but then I would never get a phone call to set up an appointment. So at the time, there was just a couple of them. I was like, whatever, I'll just keep doing what I know is working for me at the time. And I was just still doing the physical therapy at home
Oh,
because,
you were? Okay.
yeah, I was doing just the stuff that I knew how to do, trying to
Sure.
do the fine motor skills and stuff like
Yeah.
that.
Not paying somebody, not doing like virtual
No,
PT
no,
or
I
anything
was
like
just
that.
doing the
Okay.
stuff that I remembered, and because,
Mhm. Mhm.
I'm a nurse and
Yeah.
no,
Yeah.
we know how to take care of ourselves.
Sure.
So my last visit with them, I actually went in and it didn't go well. I basically told them to go fuck themselves because I said, at this point, I feel like unless I agree to the spinal cord stimulator, you guys don't want to take care of me. And he said, well, if you're really in as much pain as you say you are, then you would agree to the stimulator.
That's not going to do anything for you.
This isn't even like a you fell through the cracks. The entire system has been complete, like
Yeah.
even the clinicians
You,
that are supposed to be the
you,
ones that
you
are
know,
looking out for you, everyone has completely failed you every step of
Yeah.
the way. And
Yeah.
I'm so angry, and I want to shake the shoulders of the universe right now.
this reminds me of our episode with the pain expert, Mr. Michael Perry,
I'm sure you've listened to that one.
when he talks about how 20 years ago he literally had to prescribe opiates to all of his
That's
patients
still
or he would
mind-blowing.
lose his
Yes.
license. They would literally pull his license if he didn't prescribe opioids to everybody.
Right? And then it was flip-flopped, but
Listen,
And now you will get in trouble if you do.
right.
when I started nursing, I went right into labor and delivery. I was one of the lucky ones, and that's what I wanted to do. Women were prescribed and on Percocet. Do you know how long it can take a baby to withdraw from Percocet? But they weren't coming into the nursery, and a baby will withdraw probably about, oh gosh, don't quote me. I shouldn't say any medical things if I'm not actually 100%, but
Too
usually
long.
72 hours.
Yeah.
So that screaming, high-pitched, scream or what somebody would feel for withdrawal could possibly happen. But
And
we did
maybe we
have
shouldn't
babies
give.
that would be withdrawing from Percocet, but women
That's
were on
crazy.
them.
Wow.
So
Why are we giving babies Percocets, man?
Well,
they were, yeah.
There's got to be better ways.
yeah.
I know you're giving it to the mom,
Right.
Right.
but we all know the baby's getting it too.
That's what I'm
Yeah.
saying. But
Like,
babies are
there's
going to
gotta be a
withdraw from
better
that, just like
way.
nicotine. They withdraw from nicotine too. So when you have those
Yeah.
high-pitched screaming babies, when you get them
Yeah.
home and they're like, ah, it's like, well,
Yeah.
those are your
Good
little
grief.
nicotine babies.
Oh my gosh.
Oh my goodness.
Yeah. Anyway, so I left that office and then through the community, at some point, January of 2025 in my notes, I met a new pain doctor and I saw him up until October of 2025. He left and moved to California. So that
Okay.
was really, really sad. But
he
he's
was
the one.
good.
We did a CT scan. He was the first doctor to do a CT scan because we wanted to talk about the pain that I was still getting in my hip. And I was like, listen, it only happens when I flare up. He's like, look, let's just do a CT scan because no one's done it. Let's just see if there's any pinched nerves. I'm like, okay. So there's pinched nerves on both sides. Okay. So I said, fine, I'll agree to your epidural that you want to do. Go ahead and do that. Well, because it's worse on the left side, he said, I'll go ahead and treat the left side. And wouldn't you know it, before I even left there, I was terrible. It was awful. I was right into a flare. Right into a flare. He goes, I can't believe that it could be that. And I was like, it is. Like something is not right. Like it almost felt like even my face was on fire this time. And so I
Is
was
it
like,
just on the left side?
just on the left side for me. It's only on my left side for me.
Okay.
And so, and so then I was so nervous because at this point I've had such a problem with all the doctors and even just with the hospital I worked for, the people that are supposed to be there for me. I was just like, I had such a hard time that I was telling my husband, I was like, I need to make sure I get in there and talk to him and remind him that although, remind him why we did this, the CT scan and why we did this. We were trying to rule out, these flare-ups in my hip. And so when we go in there, we need to make sure that the documents, support that, because at this point, I still had no disability. So no, nothing from the hospital. I'm not paid at this point from anybody up until August of 2025. I had not been paid anything from
So you
long-term
basically
disability.
lost income once the short-term disability ran out
Yes.
because you never got you were never approved for long-term disability
So I was never approved for long-term disability. Nope.
because you couldn't give them the documentation that they needed and all the other bullshit that you were
Yep.
dealing with was the reason why you couldn't.
Yep. And
Oh
starting in
my God. Okay,
Yeah,
sorry.
and starting in February, by then it was like I didn't know who to contact at the hospital. Like, who do I need to contact at this point? Now that I'm finally getting the treatment that I supposedly need, my
Right.
question is, who's going to manage me at this point? Does pain manage me or does neuro manage me? If it's a neuro issue, who's going to manage my care? Neuro wants to see me if I get worse, but then they're not going to do anything different. But
Mm-hmm.
then pain management, they're just dealing with a symptom. They don't
Mm-hmm.
care when I come in there. They don't care to hear about what else is happening. If I was able to, if I needed a driver because all of a sudden I was too tired and too much in pain that I needed somebody to come pick me up, because that's happened several times.
Mm-hmm.
I always have a backup if I go anywhere, if I drive, just in case I don't feel good.
Yeah.
So, but anyways, so I forgot where I was, but this doctor, I went in like a month later after the epidural, and I said, "Hey, I just want to make sure our charts match. I just want to make sure that um, that you and I are on the same page. That we did this only to prove this, that the epidural wasn't going to work, and it didn't. I had another flare up. It affected my left side." And so he's like, "I promise you, I will make sure everything follows." So I really felt like here now I finally had a doctor that understood me. So he's like, he goes, "You haven't tried any pain medicine." He goes, "No, nothing narcotic." And I said, "No, but at this point," he goes, or at this point, I said, "I'm napping like 3 to 5 hours a day." I'm like, "I'll do something for like maybe 30 minutes to an hour, and then I need a nap for recovery." Like I can't handle it. And the heat here in Arizona, it's terrible. I
Right.
swell up, it pinches my nerve. That's all I could think of is my hand would swell, my nerve would get pinched, and then things would just go to shit. I just wouldn't feel
Mm.
good, just did not feel good,
Yeah.
all the way around. And so he's like, "You've done it for this long without anything." He goes, "Because it's going to get worse at some point." He goes, "Why don't we start with something small?" He goes, "Let's start off with the low dose pain patch." He goes, "That way, if you ever need narcotics for breakthrough, then we have something we can use for breakthrough." And I was like, "Okay, well, is it going to make me constipated?" Like I went through all the, is it going to make me constipated? Is it going to make me go to sleep? Is it going to, do this? At this point, also, I've already tried all the nerve stuff. I see a psychiatrist. I have a psychologist. So I've already done that route too, because that's what they've also said is, "Oh, well, maybe you need to change your mood." So we did all that. I did try whatever they suggested as far as antidepressants go. Um, and the side effects for me were awful. Like
Mm.
just I just didn't like it.
So you went off
Um,
those.
yeah, so I got off
Yeah.
those. And yeah, for some reason, I think like Lyrica and one of the other ones, I
For the
was so
nerve stuff. Yeah.
sleepy,
My husband
so
takes Lyrica
sleepy.
every
Yeah,
day. Oh, it makes
yeah,
him tired too.
yeah, yeah.
Yep.
See, and I would just tell the doctor, I'm like, "I can't do this. I don't know how people function on it." And then like I would meet a couple people that didn't have CRPS, and they would be on it. They're like, "Well, it doesn't work like that for me." And I'm like, "Okay, so
Mm.
what?" Like, who cares? We all metabolize things different.
Yeah. Jake
But
is
it
always
makes you
like,
feel crazy because
I've never napped
it's
so much in my life.
right,
It's,
right.
yeah.
Um,
Oh,
so
gosh.
yeah, so I agreed to start this pain patch, and things started to change. Like little, I noticed that I wasn't napping as much,
Uh,
still get swollen, still have flares, but maybe my flares are maybe 4 times a week, not as much.
mhm.
And so when he left in October, that made me really nervous because I was like, "Well, who else is going to take care of me now?" I'm like, the thought of having to find another doctor just frightens me. And he's
Yeah.
like, "Just stay with this doctor. You'll be fine." I'm like, "Okay." Well, in February of 2026, on a Sunday, we got a phone call that says their office closed effective immediately.
Oh my God. Okay. All right. This is like a whole other problem that I could talk about in a totally different episode. Sorry.
I know.
Why providers are leaving?
It is
Why are they?
another episode woven through this one.
Yeah, it's
I
all
know.
about the system itself collapsing on itself and pushing
crazy.
providers out. Yeah.
Uh,
So
Or
it's
my-
like Mad Max of healthcare. You
Yeah.
got to go out and fight for your fuel, man.
yeah.
But no, I'm a nurse, so I understand, right?
Right.
Jesus.
You got the insider
It's so
perspective.
ridiculous. Yeah.
So you have a new doctor,
And that's almost the worst part is they're like, well, you know how it works.
right?
It's like,
Yeah.
it's broken. Fix it,
Yeah.
please.
Yeah.
Like
Yeah.
they're just accepting the fact that the whole system is non-functional and
Right.
that they can't really do anything for anybody. And they're acting like, oh, well, no big deal. It's just how it is.
We'll just everyone's giving up.
100%.
Like, can we fix it, please? Like,
Yeah.
it really, I feel like it wouldn't even be that hard to start fixing it.
Well, let me tell you where the fixing needs to start.
Money?
Okay.
Yes.
We're not
Money?
gonna. It's up
As
here.
money.
It's up
Yes.
here.
Yeah, it's the money.
Yeah.
Well,
Get
so
rid of
when
the
this-
insurance companies.
Yeah.
Right.
Single payer system.
Yep.
Make the pharmaceutical companies sell us things at a reasonable price.
Yeah.
Stop charging $8,000 for the test in this room and $500 in this room.
Yep.
Right. It's insane.
Like
It's
it's
terrible.
insane.
It
It's
is
absolutely
terrible.
insane.
So before
Yeah.
we go off the rails here too far, and
Oh, I'm already off the rails.
Yeah.
forget it. It's over. It's over.
We could split this into as many podcasts as you like.
Oh my
right? Yeah. Oh, we're definitely bringing you back.
Oh, there's definitely a round table coming.
Yeah, for sure. So okay, so you've got a new doctor. You're on a pain patch.
Yes. Okay. So he
you're-
leaves.
You feel like you're managing things at this
Yep.
point. Are you on long-term disability yet?
I am now. Yes.
You are now through your
Yes.
employer.
No.
I'm like, are you
Through the
already, I was
state.
like, you already have to be like
Through the
separated from
state.
your employer at
Through
this
the
point,
state.
right?
Yeah. Oh, Social Security. Sorry, my husband's telling me.
Okay.
Social
So
Security.
you applied for disability. You got all the state
Yes.
benefits. Basically,
Now-
we were thinking about doing it with that my husband too. So.
Yeah. In August of 2025, I did get a call from the disability management company at the hospital that I work for. And they're
Uh-huh.
like, hey, we wanted to talk to you about coming back to work. And I said, well, funny you should say that. I'm like, my pain management doctor, as of right now, I asked him if he'll, fill out all the paperwork that you will need. And he said that he would go ahead and do that. But he says that he really isn't the one to manage my care. My primary doctor said that she wasn't the one who diagnosed me, and she's kind of doesn't want to manage my care. So I'm not sure. Who do you recommend I ask? I'm not going back to the surgeon's office and talking to them about coming back to work. I mean, I don't want to lose my job, but I mean, at this point, it's been 3 years.
Uh-huh.
I don't know what I can do for you, but I do know that. And they're like, well, we wanted to check on your disability. I said, my long-term disability? I was like, well, I said, I applied. I said, but they denied me because they said I didn't have the medical documentation. I said, so I did submit the new stuff from the new doctor and I still was denied. So we can try that again.
Thanks for
well-
nothing.
So I go and I look and they give me the name of the contact person. And I told my husband, I said, that name looks so familiar. And I looked through my old journal notes and it is the same person I contacted in December of 2022. In August of 25, I talked to her on the phone and she's asking me for all this information. And she's like, well, if you get approved. And I was like, okay. Within 24 hours, 2 years of income was deposited into my account from the same person that
Shut
originally
the
denied me.
door. Are you shitting me right now?
I'm not shitting you. Nope.
Oh my God. Oh
Nope.
my God.
See?
And I didn't feel
people are
better
like,
about
"Oh,
it.
that's
I
a lot of
should.
money."
I should be
Yeah.
grateful, but I
It
don't.
doesn't help if they wait 2 years to give you the money.
Like,
No.
That doesn't help.
Yeah.
I mean, I'm
I mean,
glad.
nice that you finally got it, but that
But
2
they want,
years
but they
of
have to be
struggle
paid
to
back
get
because
there.
I was approved by disability.
What
So now they want their money back.
a lot of people never would have made it that far without that money.
But you
They
should-
literally would have died.
Right. Yeah. Yeah.
They would have been homeless and dead
Yeah.
No
without
kidding.
that money.
Wow.
Yeah.
That's crazy.
So yes, I'm grateful. Don't get me wrong, but I'm like, but that 2 years, like you're the same person that had, like you could have approved it 2 years ago. That hurt. That hurt. Well, 3 years. Sorry, it was December of 2022, and this was August of 25.
Right.
Damn,
So,
this is the stuff, that makes people go postal,
Yeah.
so to
yeah.
speak, you know?
Yeah. So,
Oh
okay,
my
so doctor
God.
leaves. Doctor leaves, and I'm like, okay, before you leave, who do you suggest I go see? He's like, just stay with my PA because he'll do the
Mhm.
same treatment. And I was like, yeah, but the other doctor that's here, him and I are not, we don't get along. Now, the other doctor that ran the clinic, him and I did have an altercation. So he did come in one day to fill in for my doc. And he said, the first thing he said when he comes in is, it was something like he wanted me to tell him all about my injury. And I was like, from the beginning. And I looked at him and I was like, did you read my chart? And he's like, well, yeah, I mean, it's in here somewhere. And I was like, well, it basically explains it. He goes, how do you feel about a spinal cord stimulator?
Oh my God.
Yeah. And I said, I
Oh
appreciate it,
no.
but I'm not interested. And he kept talking.
Uh-huh.
I appreciate it, but I'm not interested.
Yeah.
And he kept talking. And he was telling me about his dad, who benefited from it, and his uncle and somebody
Yeah.
else and somebody else. And tears streaming down my face. My husband's in the room and I look up at him and I said, does your dad have CRPS? Well, no. He has back pain or he has other issues. And I said, okay, so I don't really care what you say. I don't care who has been benefited from getting this with the spinal cord stimulator. Do you have anybody that you've treated for CRPS? Anybody? He's like, oh, yeah, yeah. Well, I do. And I said, okay, well, unless you can produce some patients for me that I can talk to that have benefited from the spinal cord stimulator, I am not interested in what you have to say. And there was
Hmm.
something else. And he goes, I think you're projecting. And I was like, he goes, I didn't mean to upset you. And I was like, well, you did.
Yeah.
And you know what? You're right. I probably am projecting, but you're not listening to me. I said, I need you to understand something. Both of us were nurses. We did our research. I've been doing nothing but research. That's all the time I have in my life right now is to do research.
Yeah.
So I do know what's in the best interest for me. And he's like, well, the gold standard is a spinal cord stimulator. I'm like, that is incorrect information. Incorrect information.
That is your
They
opinion.
keep trying to treat
Yeah.
you for something you don't have.
Yeah. And so I told
Like
him, I
they're
was
literally
like, you know
trying to
what?
treat you for things you don't have.
I told him,
Crazy.
I said, you know what? Because he would not stop. And I said, you know what? Why don't you get me in contact with somebody with it? So out of our whole entire appointment that I was there, that is the only thing that he followed through with because like 24 hours later, I got a phone call from one of the reps. And I told her on the phone, I said, I apologize to waste your time, but I have no interest in talking to anybody with
Hmm.
CRPS that has this. I really don't. I'm not interested in it. It's not for me. I have a pacemaker, by the way, and I'm not interested. My pain is not, we just started addressing it with a pain patch just
Hmm.
recently. I've done the yoga, I've done the meditation, I've done all the other things that you guys have asked of me,
Yeah.
not doing the spinal cord stimulator. I've even asked for bioneurofeedback, if anybody knows what that is.
I have no
So,
idea what that is, but
yeah,
we'll have to look it up,
yeah.
I guess.
So,
Wow.
but yeah, so when he left, I was fearful of that. I don't want that other doctor. So in
Hmm.
February when they closed, it was kind of like, all right, well,
What do
I'm
you
not
do?
surprised that you closed. But then it
Yeah.
left me in the same spot of like, how am I going to find another doctor?
Hmm.
But then I realized that now I get to pick it. In some way, shape, or form, now I get to choose. I'm stronger. I'm smarter about my syndrome. There's definitely more research that's out there. There's lots of support now. Like the group that I was telling you about, their
Hmm.
last conference is really interesting. So if you can sit through it, if anybody could, it is a really good conference. It really does talk about a lot of stuff. And the best thing I love in there is that they keep talking over and over again that when they did these original studies, they didn't separate people. So like if you had a group of people that had CRPS and you had a group over here that had their limb was like swollen and red and like inflamed, those are usually indicative of the beginning of like acute CRPS within like the first 6 months. And a lot of studies and a lot of the medication that's out there right now, they're doing one in Italy. It's the only place that you can do it right now is in Italy. Um, that one is for your acute patients. The people like me that are in our chronic phase where our limb looks purple most of the time, it gets cold,
Hmm.
significant temperature changes, we still sweat, we're in that chronic phase, but they still have us all clumped together in all of the research that they're doing. They are, so now what they were talking about, which was really great, is they're like, we figured out where our problem is. We figured out that we need to divide you guys even more because it is
Mhm.
so different. Everybody responds differently. So I love that. Anyways,
That's
moving
good.
forward, um, so I started to research and I started to call different places around the valley. And then I ended up calling a lawyer. And the lawyer happened to be because of a patient that I had taken care of. Um, it was their family. And I called him and he's like, you're I was just inquiring. I didn't know who I would like if I were to sue anybody. Mine was just like this delay of care, like just led to so much more. And of
Right.
course, I'm a year or two late of anything being done because they're like, well, when did you know you had it? Well, when did you know it was going to be a disability? I was like, well, shit, I don't I'm like, well, that depends on who you ask, like I'm
Right.
I
not,
mean,
yeah,
it's a thing they don't even really have a good definition for. They don't really have treatment for it. They don't really know how it works, what
Right.
it is,
right.
why
You're
it
supposed
happened.
to know.
So like, how are you don't even really know what it is because they
Yeah,
don't even really know what it is.
right.
Yeah.
But he did send me over to my new pain doctor. So I do have a
Okay.
new doctor and he basically like I put out a reel on my social media and basically asking the universe if you believe in that kind of stuff, to give me a doctor that wants to sit down and hear me.
Yeah.
Like I've done the research, like
Manifest
let me come
destiny.
to you. And he literally said that to me. This new doctor
Oh.
I have literally was like, you know what? You have way more time to look at this. Like I would rather you come to me and let's talk about a treatment plan
Hmm.
than not. He's like, you've worked so hard on your own, at this point, and I'm so proud of you. And I was like, look, I'm like, I post a video. So I got roller skates the day I got injured, and that was a dream of
Yeah.
mine. I wanted to roller
Oh,
skate,
no.
46 years old. I wanted to roller skate, and I knew I could do it because I was an athlete. That has saved my fucking life, saved my life.
Yeah.
But when I first started to tell my story, I was judged because how could I possibly have CRPS? Well, laboring patients that don't have an epidural, sometimes they walk. They move around when they're in
Uh-huh.
pain. They move their bodies around. That's what I do. I move when I'm in pain and I'm uncomfortable. I move my body.
So you roller skate.
Skating, huh?
You roller skate.
So I roller skate and my arm hurts like a motherfucker, but
Yeah.
I'd rather move my body and as long as I can. This doctor,
Yeah.
if I'm going to be in a wheelchair, right now I'm not. And if getting up and moving my body and fighting the pain and fighting the discomfort um, and what it goes through, I'd rather keep trying to move as long as I can. The only
Yeah.
problem I have is doing like weightlifting with
Yeah.
my upper body. And
Yeah.
I have to decide when I want to do it. If I do it
Mhm.
in the morning when I feel better, that's great. But then do I have time to take a nap? If it starts to flare up.
Yeah.
Um, so it just, yeah,
I love it. And I love your email profile name is Foxy Skeeter.
yeah,
So
yeah. Thanks,
I
thanks.
would say you are definitely a Foxy Skater.
Thank you, thank you, thank you, thank you.
That's so
Yeah.
cool.
Well,
Yeah.
so I brought in, I mean, I used to do bereavement. So I actually, not to go into much detail, but years ago, I helped with another nurse and a social worker. We started Embrace Palliative Care Foundation. It's no longer in existence, but at the time, we had helped families who were diagnosed as, pregnant with babies that had congenital anomalies that may or may not be compatible with life. And we would help them through the life of their child. So whether their child did survive or not. And so we would help prepare them. And so when they would get that diagnosis, we would do the studying for them. We'd tell them, don't look at the internet. We'll bring it to you. And we would talk about the worst case scenario, and we would talk about the happiest, whichever that would be. And then we would also, anyways, the reason why I brought that up is because bereavement was something that was really special to me. And through this process, the last 4 years, I found that I would often think of those parents and I would think about their loss of a child. My whole life turned upside down. I'm still trying to figure out what it is to not be a labor and delivery nurse and not connect with those people. Um, but man, they had so much strength and they made it. um, But I also realized that it doesn't have to be just death.
Hmm.
That grief can be the total change of your entire life. Like, I thought I was going to be a labor and delivery nurse from the age of 10. And so it was something I really, really loved. I loved connecting with my patients and empowering them. I missed that the most. And then, of course, going through this whole process, I really felt that even the nurses that could have helped or could have been there to even listen didn't. They didn't reach out where they could have or could have helped me in different like even no, like you're a nurse, we have an oath, I don't know. I just felt very alone. And I had the opportunity like 6 months in. I knew an old news journalist that really wanted to push my story, and I didn't say anything. And she's like, "What if this was happening to your daughter? You'd want to scream it from the rooftops." I'm like, "Yeah, but I feel like somebody always comes at me with somebody has it worse." Well, someone has it worse. And so that's what would happen every time I put out my story is I would get comments like, "Do you really have it? You're skating. Do you really have it?" And I was like,
Mm.
and then I saw one girl that posted in one of our groups, and she said, "I didn't want to post this." She was sitting in a pool and she goes, "But I'm affected in my arm." She was like 57 years old. She says, "I'm affected in my arm and I can't help it if I have a good day. My pain level on a daily is a 3. That's mine, right?
Hmm.
So I can live with that. I can live with a 3,
Yeah.
but she's like, I can't post my happiness because I get judged. But, you
That's
know,
terrible.
and I don't post any of the photos that you see. I haven't posted any of that on social media. And I don't
Mm.
know, I don't like to see it. Like I have videos and I have all sorts of things. My hand will also contract. That's what I was going to say before too. It also does these muscle contractions and cramping. And so it'll start to like just move and deform in all these different ways. And it'll
Oh,
just be weird during a
yeah.
massage. During a massage,
Oh my
it'll start to
goodness.
happen. Like,
Yeah.
Yeah, it definitely did something weird to your nervous system. It's like your energy system got tweaked.
yeah, that's the whole thing. Is it my doctor that I had in February, the one that started the whole part of my now healing process, I think,
Hmm.
is, he goes, "Christine, unfortunately, you have a syndrome that you can't be happy or sad. You have to be just mellow
It's
all the
not
time." And
fair.
I'm like, that's not realistic. So,
Yeah.
but
Ugh.
You got to get very zen.
yes, the
Very
yoga and
zen.
meditation from the
I say
neurologist. He's
Yeah.
so smart.
that'll help. That'll help. That's
But
something.
they did end up finding that you do have actual damage to your nerve in the hand, though, right? With the CAT scan.
That's what
Is that
they
what you said?
say. I mean, they just assume it is where, between my knuckles where it is, but there's no way to actually test it. And by the way, you don't actually need a nerve conduction test to prove that you have CRPS.
Oh,
Sure.
okay.
You don't need it at all.
Yeah.
Good to
So,
know that. Well,
yeah.
if anyone's listening and
Yeah,
going
you
through
don't
it,
need it.
yeah.
Yeah.
Wow.
Have you read The Body Electric?
No. Mm-mm.
You might
Put that
want
on
to
your reading
read that
list.
book.
Yeah,
Yeah.
I haven't read it yet. Apparently I
There's
do too, but
another one called The Way Out. I don't know if that might be helpful for you as well.
Okay.
I can't remember who wrote that one.
The wave,
The
the way
Way
of,
Out. The
the way
Way
out.
Out.
Okay.
It's like the way
Okay.
out of pain. It's actually about chronic pain where there's no actual physical damage.
Oh, yes.
It's just
Yeah.
your nervous system has trained itself to respond badly to things like that.
Yeah.
And
Almost
he
sounds like
kind of has
neuroplasticity or
it
whatever.
would, yeah, it's very neuroplasticity based. It'll be
Yeah.
more like what you were probably doing with your psychiatrist more than your actual doctor from that book.
Yeah.
The Body Electric is very much just straight science about the electrical systems of the body and the healing
Oh,
systems of the
fascinating.
body and stuff. It's a fascinating book.
Yeah.
all right, put that on your reading
Like
list.
every doctor who deals with the nervous system needs
Yeah.
to read that book. Like they
Yeah.
need to read it.
Required reading.
It should be required reading for any
Yeah.
doctor working specifically with the nervous system.
Wow.
Yeah.
Well, this has been quite a journey, and it sounds like you've got a doctor, you've got it under control to the best of your ability at
Yes.
this point.
Yeah.
You have some support, the pain patch, all the other things, and you're on disability and you're a foxy skater and
Yeah.
you're just like trying to figure out next chapter.
Yeah. Well, and
Okay.
that's what I was going to bring up about working with Embrace is,
Mhm.
so I met up with a nurse that we went to nursing school together. And 2 years into her into nursing, she ended up diagnosed with MS. And
Oh,
so 2 years into her career. So it's like
wow.
we, our lives went on as, we were lived on different sides of the city and
Mm.
just kind of watched each other's families grow up on Facebook. After my injury, um, we reacquainted.
Okay.
And so a few years ago, I was sitting in her craft room feeling not sorry for myself, but kind of going through it. And I was like, here I am crying to you, but your career ended after two, and I
Mhm.
actually had 18 years. And who am I? And she's like, there's no room for that. There's no room for that judgment at all. And it was the first time that I was like, cool, I can actually talk about how painful this is, with someone else and
Yeah.
kind of what it can look like. But as I was sitting there, I looked up and I go, she looked like she had like Joanne's throw up in her craft room. I love it. It's the most beautiful thing I've ever seen. She's the most amazing artist. But anyways, I look up and I was like, who's this jeweled plant, this plant hanger? It's like beaded, plant hanger. It's beautiful. And it was like with jewels, not with
Uh-huh.
wood beads. She's like, my grandmother made that. It's like 60 years old.
Oh,
I was
wow.
like, really? I'm like, I'm gonna make that. She's like, you are? And I was like, yeah. So that's what I do. I started making plant hangers, but I use antique or vintage jewelry. And just recently, I
Oh,
made a few for families, right, that lost their
okay.
families. So they gave me necklaces from their grandmother,
Oh, I
aunt, and
love
I
that.
made 4 plant hangers for
There you
them
go.
out of this
Very,
stuff. And I I met I've met so many people, like small
yeah.
still. I'm still,
Sure.
it's unbelievable the stories that are attached to what
Uh-huh.
I've made so far. And I really want to do recycled stuff and
Oh,
yeah.
I love that. Well, if you
Cool.
have like any like if you're on Etsy or whatever, just share us those links or like Instagram pages and we'll put it
Okay.
in the show notes
Yeah,
for
Sure. Thank
this
you.
totally.
and we'll
Thank
we'll do a
you.
little promo.
That's really
Wow.
sweet.
Okay, so this might end up being a two-parter. I'm looking at the time.
Oh my
And
gosh. Yeah, I guess.
yeah, and my husband's texting
We're-
me, "Let's go."
Oh no.
He's waiting for me.
I listened to his story too the other day. Yeah, I
Yeah.
liked a lot of the
Him
stories.
coming on himself was great.
Yeah.
That's a
Yes.
hell of an episode.
It was fun. Well,
Yeah.
thank you so much for coming on and sharing your story with
Thank
us. I'm
you.
glad that you chose us, like, because you shared you're kind of apprehensive about it.
Yes,
But when the episode does drop, I hope you share it in your groups and with your
I
people,
will.
and that it inspires them. And because you're pretty inspirational. I mean, that's a
Oh,
lot of
thanks.
resilience, and you've overcome a lot, and you're still
Thanks.
going through it.
I
So
am. I am. Yeah, I mean, I could even think of a couple people that probably they have some incredible stories, and
yeah,
they've been in wheelchairs and gotten themselves out of wheelchairs. I mean,
amazing.
they've just changed their whole, system and how they've
Yeah.
handled it. So, yeah.
Wow. Well, kudos to
All right.
you, Foxy
Thanks.
Skater.
Thank you. Thank you
I'm
so
just gonna
much. It was
call you
nice to
that
meet
from
you.
now on
Yeah, perfect. Go for it. All
because we're
right.
gonna be friends now. So
We
that's
are.
just
Let's
how it
do it.
works.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!